Hi, everyone. My name is Yuchen. I am a fourth-year general surgery resident in Ventura County. I would like to give thanks to SAGE's committee to present our research here, and I have nothing to disclose. So, nursing care is centered around care, and the quality of that care is dependent on the caregiver's mental, physical, and spiritual health. Nurses are often subject to high level of stress, and stress can often lead to anxiety, depression, and burnout syndrome. Burnout syndrome can in turn cause absenteeism, low morale, poor performance, and low quality of patient care. The Monsolok Burnout Inventory Human Services Survey is a well-established survey to measure burnout syndrome. It has 3 domains: emotional exhaustion, depersonalization, and personal achievement. Inpatient nurses, in comparison to outpatient nurses, are often subject to higher level of burnout. And ICU nurses are especially vulnerable. And that causes a low professional quality of life. And the ProQual scale is a measure of compassion fatigue, which can be subcategorized into burnout and secondary traumatic stress. So despite these well-known negative effects of burnout on quality of life, really there has been very few studies that focus on these negative impacts in nurses who primarily take care of trauma patients, especially in the ICU setting. Therefore, for our study, we focus on the quality of life as well as the degree of burnout in ICU nurses in 2 hospitals in Ventura County, one of which is a trauma center, and the other one is a non-trauma hospital. So we designed our study as a survey for part-time and full-time nurses in these 2 hospitals. It includes a background questionnaire, the MBI HSS scoring system, as well as the professional quality of life scoring system. We had 100% response rate from 26 ICU nurses, 18 of which were from the trauma hospital, 8 of which were from the non-trauma hospital. Most of the participants were female with a mean age of 43.2. 11.5% of our participants had 3 to 5 years of working experience. 23% had 6 to 10 years of working experience. 23% had 11 to 15 years. And 42% had greater than 15 years of working experience. 72% worked day shift, 28% worked night shift. So interesting, 91.5% of the nurses had at least moderate, if not high levels of burnout, and which is significantly higher than most other studies. And 67.3% of our nurses had low professional quality of life, according to the ProQual scale. Correlation analysis showed emotional exhaustion and depersonalization were most highly correlated to the MBI scale, and personal achievement had a weak negative correlation. The professional quality of life score had a strong positive correlation with secondary traumatic stress and a weaker correlation with compassion fatigue and burnout. Multivariate analysis showed that working night shifts and greater than 15 years of working experience were the most predictive factors for burnout. And 10 to 15 years of working experience within a trauma center were predictive of both burnout and a low professional quality of life. So in conclusion, most of the nurses who participated in this study had moderate to high levels of burnout, 15 years of working experience, working nights, and 10 to 15 years of working experience in a trauma center were factors that were or contributor to burnout or low professional quality of life, personal achievement, and less than 5 years of working experience were possibly protective, although they were not statistically significant in our study. We recommend further research to focus on designing targeted interventions to mitigate burnout and improve well-being in this type of trauma ICU nursing care and improve quality of life. Thank you.